Hello, good afternoon, good morning, good evening, wherever you are. Hi, my name is Manit Sitimat, and I'm from iCAPS Foundation here. And on behalf of iCAPS Foundation, it is our pleasure and honor to welcome all of you here to this very interesting and important webinar on procurement in ASEAN. This event is made possible through the support and collaboration between the Access and Delivery Partnership ADP and hosted by the United Nations Development Program or UNDP with PMUB, the Ministry of Higher Education, Science, Research and Innovation, Thailand. And last but not the least, the Center of Global Development or CGD. Procurement is more than just the purchasing strategy, but it can also be more like a vital tool for enhancing efficiency, equity, and also resilience of our healthcare system. But by consolidating these efforts and leveraging collective bargaining power, countries can achieve not only the cost saving, but also ensure equitable access to essential medicines. And a very key objective that is resonates and embedded deeply in the core principle of universal health coverage or UHC. Today, we aim to understand and also learn from the expert in terms of the implementation experiences, particularly in the context of the ASEAN region. While the successful models like the PAHO Revolving Fund, the GAP Cooperation Council Group Purchasing Program, and also the newer initiative like for drug cancer, the cancer drug antidotes or antibiotics, these are provided us with very useful insights. And we are here to explore how such strategies can be adapted to meet with the unique needs and challenges with our own context, our own region in ASEAN here. Through this platform, we will hear from experts who have spearheaded different, procurement initiatives around the places, gain insight from their experience into the best practices, and discuss strategies that perhaps could help us overcome barriers such as regulatory disparities, custom challenges, or even other commitments from local industry as well. So this discussion that we're going to have will serve as a very important foundation for future collaboration and innovation as we collectively work towards strengthening our healthcare, but also regional health security in this interval. But before I introduce to our moderator, I would like to start with this small interactive session, pulling up the poll so that all of you could get a little bit warmed up of what we're going to discuss today, if you don't already know about procurement, right? So yes, let's quickly grab on this question. You can answer based on your your feeling, your experience, your knowledge. So there's no right and wrong. Let's hear what you think of this question. I think we got some answer already. Yeah. All right. So at least I think majority of participants have answered. And the first one, procurement can not only be used at the national level. And yes, the majority have answered no, which we will see. Yeah. And the second question, procurement can be applied to ASEAN countries. Yeah. So, wow. Most of the people answer yes. So maybe there's some potential to it. Let's also see again from this session for today. Okay. So without further ado, may I please, introduce our honorable moderator, Dr. Inthira Suya. Dr. Inthira Suya, she is a research and M&E specialist at the UNDP Bangkok Regional Hub. She also supports on the ADP, which focuses on strengthening the healthcare system to ensure equitable access to essential health technologies. A particular interest within this neglected tropical diseases within this LMIC settings. Dr. Inthira, the floor is yours.
Thank you very much for the warm introduction. And hello, everyone. Thank you for joining us for today's webinar on pool procurement strategy in health technologies. I am thrilled to be your moderator for this important discussion. And Manit has already mentioned about the benefit of the pool procurement, and also the poll already result that we are all seeing the opportunity to do the pool procurement in ASEAN country. So the objective of the today webinar is we aim to exchange experiences, learn practical strategy employed by various organizations, and to explore opportunities for implementation in ASEAN countries, because I think we know that the pool procurement is an innovative approach that allows organizations and governments to consolidate the purchasing power, negotiate better prices, and improve access to essential medicines and health technologies. And our agenda today, let me go through the agenda first. So our agenda today includes 3 presentations from esteemed speakers. First, we will hear about the secure initiative for antibiotics. Second, we will learn from India National Cancer Grid Initiative for pool procurement in oncology. Third, we will explore the iCAPS initiative for antidotes across Southeast Asia. This will be followed by a reflection and discussion session with our global experts, and we will conclude with a summary of key takeaways. I encourage you to actively participate and reflect on how pool procurement can shape healthcare access in our region or in your region. For questions, if you have questions, so please type them in the Q&A box or in the chat box at any time, and we'll address them either after the presentation and or during the discussion session. So I think we should let's move to the first presentation. Our first speaker is Dr. Kim, for the project lead for the Secure Initiative. Dr. Kim specializes in antimicrobial resistance and quality assurance. She has worked across South Africa's healthcare sectors and supported African countries in AMR national action plans. She currently leads Secure, focusing on improving antibiotic access in low and middle income countries. So please join me in welcoming Dr. Kim. Dr. Kim, please proceed with your presentation.
Thank you so much, Inthira, and I'm very privileged to be able to share some of the work that we have started on modeling for improving access to antibiotics through the Secure Initiative. I'm assuming you can see my slides. Good, thanks. Hold on, let me move. So we know that superbugs are emerging everywhere, and they're starting to outsmart even our most important and available antibiotics. So currently we're losing this race, not only because we're not innovating for new antibiotics fast enough, but we're also not improving access to the antibiotics that should be available in a lot of the LMIC countries to improve the ability to treat standard and common infections. So AMR is in low and middle income countries is one of the commonest issues with AMR. So this study that was done a number of years ago showed that resistance to antibiotics is growing. By 2050, we estimate that about 9 million people in low and middle income countries will be dying from a drug-resistant infection each year. So not only are LMICs more greatly impacted by antibiotic resistance, but also when new and existing antibiotics come into the market, these countries are also facing significant access issues. So only 10 of the 25 new antibiotics that have come onto the market recently were registered in more than 10 countries. And if you look at that map, you'll see the majority were registered in countries that are on the high income or in the global north, and fewer were registered in the global south and the low income countries. And even when they registered, some of these new reserve antibiotics, which is the last resort ones, are often priced out of reach. But how big is this access challenge? So we've tried to estimate the access challenge for these antibiotics. And what we did was we used the Graham study, which looked at the amount of patients that have died from AMR-related infections. And we estimated the number of patients that would have a very specific or resistant infection called a carbapenem-resistant infection. And we estimated for 8 countries in the LMIC setting that 1.59 million patients would have been affected. We then took data from IQVIA that showed the number of patients that were, or the number of courses of antibiotics that were used to specifically treat this resistant bacterial, and we realized only 85,000 odd were being treated or receiving a course. So there's this 95% drop off in lack of access. Some of it might just be because the health system doesn't allow the patients to get to a health facility. But there's a significant portion of these antibiotics not even being available for patients to receive treatment, even if they make it to a facility. So through the work with Secure, we've unpacked what are the challenges across the different types of antibiotics. And the WHO classifies antibiotics in 3 different classes: access, watch, and reserve. So access antibiotics are the ones that are normally primary healthcare, used to treat common infections. They're very high volume products, typically generics or off patent, and they're very low cost. The problem here is we often have frequent global supply chain shortages or manufacturing bottlenecks that result in the supply not being able to meet the demand. In some instances, countries are not able to forecast how much they need, so then they put the supply chain processes into disarray because they have these unusual orders that come in. Or we've got suppliers that just simply go, the margins are too low, and they exit from those markets. On the watch antibiotic side, this is more antibiotics used to treat hospital-based infections, sort of IV antibiotics. And here we've got medium products. Most of them are off patent again, and they're medium cost. Here we have an affordability issue, which is relative. A lot of low-income countries do not place these products onto the essential medicines list, and therefore they don't have them available when needed, just because they're slightly more expensive. And then often they're not included in procurement processes, and there's often also for these antibiotics, there's supply shortages just because of the fluctuation in demand. And on the last side, we have reserve products, which is your last resort antibiotics. And here, these are generally on-patent products. They're highly expensive. They're used in very low volumes, and there's a lot of erratic supply and need for these products because they're used really to treat those drug-resistant infections. So here, the big access barriers, affordability, and fragmented or erratic demand, but also these products are not widely registered, and therefore countries don't have the ability to introduce them in a safe and secure way, so that we stewardship these antibiotics so that they don't generate resistance in the future. So this is where Secure as an initiative has been developed with the aim to improve access to these antibiotics. So Secure is a coordinated partnership and initiative between World Health Organization and the Global Antibiotic R&D Partnership. The mission is to support countries to address their drug-resistant bacterial infections by expanding access to these essential antibiotics, but in a way that makes it sustainable and equitable and appropriate. We have 4 key work areas, and today I'm really going to focus on just one of them. The first one is around optimizing antibiotic portfolios, making sure that the antibiotics that are needed are the ones that are on the portfolios of countries. Information transparency enhancement. How do we improve the amount of information that countries have about the good quality suppliers that are providing antibiotics in order for them to make the good procurement decisions? Efficiency and supply security. I'm going to talk more about that in terms of the options for economic and procurement tools. And then, of course, we want to preserve antibiotics going forward because unlike other drugs, antibiotics develop resistance, or bacteria develop resistance to these antibiotics. And therefore, we need to make sure that we steward their delivery and their access in such a way that we can preserve the effectiveness of these antibiotics. Secure acts as an enabler and an advocate for market interventions. So we see ourselves as facilitating alongside other technical partners, making sure that we work with existing procurement entities or countries that are looking at procuring, or even regions like is being proposed for ASEAN. We want countries to work in such a way that they improve their solidarity to make these decisions in an equitable and sustainable way within their health budget constraints. So this is just an expansion of the bit that I've just spoken about, and I'm specifically going to talk more about the work we've done on forecasting tools and on identifying different procurement and financial initiatives and tools to be able to improve access to the different antibiotics. We've also done some health benefit modeling, which I'll also share. So the methodology we have used was we have understood what the key challenges are with those antibiotic archetypes. We then try to understand what are the key economic and procurement levers that would address the access challenges. We tested them by actually modeling them with real live data from some LMIC countries in terms of price of products and utilization levels. And we validated these models with a large number of experts, including experts in the global procurement mechanisms, country experts, as well as experts within WHO. So we've actually published this piece of work in our economic and procurement tool. Key interventions that we tested on the procurement options is we said multiple countries must pool together. So the modeling was based on about 3 to 4 medium-sized countries that would together make up a 100 million population pool. We then looked at single vendors or multiple suppliers to be part of that pool. We also examined different regional antibiotic stockpiles, either just for emergencies and outbreak response or something that was going to be used more actively for standard supply. We looked at different funding supports to support the cost of the products, because remember, one of the issues is around affordability. So we looked at, would we provide guarantees to the suppliers, like a volume or a revenue guarantee, or would we look at temporary time-limited subsidies to make the antibiotics more affordable? So this would be a subsidy that makes the price more affordable to the country to pay, but it gets paid to the suppliers to make sure that the suppliers are able to continue to access the market. So the goal was to create a stable, attractive market for the antimicrobials for the suppliers, to make sure the countries have enough health budgets for purchasing, and over time can make sure that these antibiotics are incorporated in their normal health budgets, and encouraging suppliers to register the products in markets they're not registered in right now. So then again, we go back to these different access challenges, and then we try to apply the most suitable economic and procurement tools to the different types of antibiotics. And you'll see Access Watch and Reserve is up there again, and you'll see the examples among the antibiotics that we looked at modeling. If you look at the access category here, making sure that you can strategically source the right antibiotic with the best quality was seen as a key intervention. Pooled procurement was looked across all categories of antibiotics. In the access group, more around making sure that you can get a good price for an affordable quality product rather than just going for the cheapest product on the market. We looked at regional stockpiling, mainly to improve the supply and demand, and also for management of emergencies, for outbreaks, etc., for the access group. On the watch side, also, pooled procurement was seen as an improvement for affordability and as the regional stockpiling as well. And there we looked at supporting the countries from a financing point of view with a small catalytic subsidy, which would last for less than 5 years and would be a minuscule amount just to improve affordability. On the reserve side, pooling was seen as a very strong lever in terms of improving the affordability of the product, but also improving the manufacturer's ability to enter the markets because they now have a secured supply. The regional stockpiles were only there to limit erratic demand and make sure that there's always product available. We looked at supplier guarantees, volume and revenue guarantees to support the entry of those suppliers into market, and a slightly more moderate catalytic subsidy, also time limited over 5 years. Enabling interventions are still needed. So you can't do all of this without making sure that you have the right mapping of the suppliers, you know the needs and demands forecasting for the countries themselves for those products, and there must be regulatory and policy interventions that the countries have in place to be able to address shortages and to improve the ability of these new products to enter the market. So how can this pooling mechanism work? It may function in the following way. Countries get together and Secure would support, from a technical point of view, a procurement entity. This procurement entity would coordinate the pooling of the countries, and if necessary, Secure would support with a service fee for the administrative costs to get the entity up and running. The participating countries then place their orders with this procurement entity, paying based on agreed unit costs, and the procurement entity then supports the country forecasting as well as the pooling of orders. The procurement entity itself will work with multiple manufacturers to fulfill these orders, ensuring the strong supply chains. The manufacturers ship directly to country so that you limit the amount of delays in product getting to the countries and allow the efficiencies of products being available when needed. Secure would look at the subsidies or guarantees to these suppliers using donor funds where these are available, and each country will manage distribution from the time that the product gets into their borders. There would be a stockpile, but this would just be an emergency one where countries can receive an emergency order for acute shortages and request that delivery directly. And this would be managed by the procurement entity with the suppliers. So coordinated procurement, in a way, is a flexible approach to market coordination, but it could be as simple and as low tech and degree of coordination as just informed buying, where countries just agree to coordinate their discussions, they share market intelligence with themselves, and then they agree on a price with the manufacturer. The group contracting could be more complicated, where you start to agree on the group as a group that you want to coordinate with the purchaser. And then on the very high end of coordination, all the countries agree to pool, order, and procure together, as I just described in the diagram. So what are the benefits of purchasing through this kind of mechanism? And this is an illustrative example. The watch antibiotics, let's say, typically costs $50 in country A, and there's a demand of 1,000 packs per year. So the country's paying 50,000. There's 3 other countries, B, C, and D, who also have the same volume needs and are paying the same price per pack. They now come together and create a pool. And because they're pooling, they're able to secure a whole bunch of savings. The first one is from them pooling their demand and giving a large order to the manufacturer. That, for instance, could give them a 20% reduction in the unit price. And then also because they're long-term contracting with the suppliers, they get a further 10%, giving them a $35 per pack with a $35,000 saving. The benefit is that the manufacturer gets this volume commitment of 4,000 units and a single negotiation with a pool of countries. Therefore, they stabilize the supply, and there's benefits to the country from multi-suppliers, the flexible stockpile, and the robust supply chain. So this is what it actually looks like if we took that portfolio of antibiotics in a pool of countries over a 5-year period of time. We would look at the countries having paid a total of 181 million for those products in the 5 years if they weren't part of a pooling mechanism. If they join a pooling mechanism, they save 26 million over that period, which is a 12% saving. And so that pool now only pays 155 million over the 5 years for those products. And I've mentioned the country benefits. There's also a cost to create this mechanism, which is minimal in comparison to the savings that the countries are making. We've also found options that are less feasible, and these included just doing a rotating stockpile for access products without any kind of pooling mechanism behind it, and single country revenue guarantees were also not considered feasible just due to their incremental cost to the countries of having these mechanisms in place. But there's other benefits to the patients. Not only are they getting improved access, but they're also getting improved treatment. So if a country was to join a pool mechanisms within the Secure, they're getting a meropenem at a fixed price of $720 with or without Secure participation. What that does mean is that when they get into a pooling mechanism, they can buy more meropenem for that same fixed budget. So they can treat an additional 6,356 patients, but they're also saving lives because they are able to provide meropenem in relation to an alternative would have been piptaz, and therefore they're providing a better drug at a lower cost. So they're treating more patients and they're saving more lives. And then finally, we can skip that one. Just in terms of secure implementation, in my last minute or so, over the next 2 years, we're hoping that we'll improve access to a small set of quality assured antibiotics for countries that are struggling with access. This implementation, we're hoping, will occur through regional catalytic activities with existing procurement entities, or ASEAN, for example, where it's being set up. And we're also looking at international market shaping interventions for some reserve products. We're going to measure our success through availability, cost, quality, and appropriate use of these products, and thereafter we'll expand access to more antibiotics and more countries. And just to finish off, to thank our donors for Secure, and also just to mention that Secure is mentioned in the United Nations High-Level Declaration on AMR as one of the mechanisms to improving global access and appropriate use. And I want to say thank you very much.
Thank you, Dr. Kim, for sharing these valuable insights into how Secure initiative is shaping the market for antibiotics. And this includes optimizing antibiotic options, improving information transparency, creating stable supply and market predictability, and ensuring the safe introduction of new products and stewardship. It looks like we don't have any questions at the moment. However, if the audience has have questions, please feel free to type them in the chat box, and we will address them during the reflection and discussion session at the end. So I would like to ask about I saw the diagram that the enabling factors about regulatory and policy. I think the regulatory and policy, they have been mentioned that there are barriers for setting up the pool procurement. So I would like to hear about your thought on these kind of barriers, and how can the model that you presented can overcome this kind of barriers.
Thanks so much for that question. So the paper around regulatory and policy interventions has just actually been published. It was published last week, Friday. And in it, we describe what national regulatory authorities are doing alongside the procurement mechanisms in the Ministry of Health to make sure that they collaborate on understanding which products have the biggest gaps and access challenges and where they're having their shortages, but also making sure that they have mechanisms, both regulatory mechanisms to accelerate registration, as well as policy mechanisms to make sure that those products are being entered into the essential medicines list and the procurement processes to improve availability. But things such as innovative ideas, like looking at electronic labeling for the pills so that it makes it easier to bring other products from other countries into the country when there's a shortage, or looking at mechanisms of accelerating the time between registration, inclusion in EMLs and treatment guidelines, and availability at the country. I'll share the link for that in the chat box as well. Thank you.
Thank you. Thank you very much, Dr. Kim. So let's now move on to our next speaker. Next, we will have Dr. Manju Sengar, Professor of Medical Oncology at Tata Memorial Hospital in Mumbai, India. Dr. Manju is a key member of the National Cancer Grid, and she has been instrumental in improving access to affordable cancer care in India. Let's welcome Dr. Manju Sengar. And Dr. Manju, the floor is yours.
You're on mute, Manju.
I hope I'm audible.
Yes.
Yeah, thank you so much. So a very good afternoon, and thank you organizers for giving us this opportunity to showcase the work which we have done from the National Cancer Grid on the pool procurement in oncology. Is this not on the slideshow as of now?
It's not on the slideshow yet.
Okay. Is this better now? Is it on slideshow now?
Not yet. What you could possibly do is to unshare and reshare again, and share the whole screen.
Yeah, I'll do that. Just let me know if this is on slideshow.
Yes.
Okay, thank you so much. And apologies for that technical glitch from my end. So just to, give, before we move on to the actual why and how of the pool procurement, which was done by National Cancer Grid, just to set context, brief about what National Cancer Grid is and what was its, the reason for its genesis. So just to, tell you that we are experiencing, and it's projected that the cancer burden, both in terms of new cases as well as deaths in India by 2040 is going to be almost 60% higher than what it was in 2020s. And this increasing burden comes on the background of existing gaps in the demand and supply, whether we talk about the infrastructure in terms of the machines, the operation theaters, or the experts, oncologists, nursing staff, or the allied professionals. So this is a report from the ASEAN, which clearly showed that there is significant gap even to handle the current burden of cancer which is there in the country. And this is going to become even wider as we experience, as we move forward. And there is going to be much more challenge, and therefore we needed innovative ways to address this. The challenge of demand supply, and not only just the demand supply difference, but there is a wide variation in terms of availability of resources, infrastructure, and expertise based on where the patient with diagnosis of cancer lives. And to eliminate all these disparities, concept of National Cancer Grid was floated in 2013 with the mandate that anybody anywhere in the country should receive uniform standard of cancer care. And to do this, we do need to ensure that there are trained human resources, and we do need to develop treatment options and diagnostic methods which are relevant for country through the multicentric collaborative research. So from its humble beginning of 13 centers in 2013, now the current number of members within the National Cancer Grid stands 360 plus. And the relevance of it is, I want to highlight here the numbers, is that number of new patients who are treated between these cancer centers constitute almost 60% of India's cancer burden. These numbers indicate that if you make a change which is relevant and important, will have impact on the management of almost 60% of patients who are being diagnosed with cancer in India. And we realize the responsibility with which this particular initiative comes up, and therefore the first step was to ensure that the treatment is based on the guidelines which are evidence-based. And these guidelines have a unique aspect because, as I mentioned, that there is significant disparity in terms of availability of resources, infrastructure, and expertise across the country. So we could not have a single set of guideline, and therefore a resource stratified guidelines were developed, which have practically three categories: optional, which is based on the recommendation, best available evidence; the optimal has recommendations which are based on the evidence as well as cost effectiveness; and essential is largely to take care of the practicality as to what is available closer and which should be the basic minimum care these patients get when they have diagnosis of cancer. The importance of these guidelines is that these are linked with the National Health Insurance Scheme, that is Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which means that if these guidelines are followed, at least the beneficiary of ABPMJ are going to receive the high quality care which is based on the guidelines. Creating guideline is one thing, but making sure that through guideline we deliver value-based care is equally important. And therefore, we have taken the approach of conducting adaptive HTA for the interventions to be included in guideline, update the guidelines based on adaptive HTA, and then update the health benefit packages based on these guidelines. The reason for opting for adaptive HTA, because we know that full HTA is going to take a long time, and we did requires something which is quick and which is meaningful for our setup in a shorter time frame. One part is developing guidelines, including interventions in the health benefit package so that people can receive it. But we know that several of these interventions cannot be included just because of pricing. So I think the pricing is equally important aspect which we need to address if we really wish to deliver universal health coverage over a period of time for the value, for the care which brings value. And as cancer medicines constitute a significant amount of expenditure in any healthcare system, more so in systems where a large number of patients are still diagnosed in advanced stage of cancer, bringing down the price of anti-cancer medicines is a very, very important initiative. We know several initiatives in country have gone on and still ongoing, including making sure what constitutes an essential medicine, the drug pricing control linked with the essential medicine list, a lot of biosimilars and generics which have come up for many of these anti-cancer medicines. However, we still know that because of the lack of uniformity in the procurement systems and differences between public and private health system, there is differential pricing, and there are no ways to monitor appropriately the quality of the generics which keep getting approval over a period of time. And despite having plenty of generics, we do still continue to face stockouts, especially in these smaller centers. And this is where the volumes and the strength in terms of the volumes which we have at National Cancer Grid came in handy, and the concept of pool procurement was floated. And this exercise has been published in the Bulletin WHO journal in 2023. To just give an idea how this entire process was run, we first established a price discovery cell with the governance structure and committees. Why? Because it was important to have a structured process, a process which has transparency, and the process where the team has required expertise for conducting a pool procurement. So technical expertise, the financial expertise, the negotiation expertise, all that was needed, and that was part of these committees which were formed under price discovery cell. The next step was a survey of medicine consumption in 3 large cancer centers to identify which are the high cost and high volume medicines, because we knew that we can't, negotiate for each and every drug. We needed to, put our efforts into something which constitutes a large chunk of the dispensary revenues. And therefore, these drugs were selected. The name of the drugs with these stock keeping units was circulated to all the members, and they were asked if they were interested in participating in this pool procurement. And after we received the letter of intent from the interested centers, the next step was we wanted to fix what we called as reserve price. Reserve price was the price at which the same stock keeping unit was procured in the previous procurement, and whatever is the lowest reserve price across these member centers who participated was the price at which we said that if you are not able to get the drug at this price in our pool procurement, you are free to not participate or not buy the drug as part of this pool procurement. After having a non-disclosure agreement, this reserve price was circulated to all the participating members, and then a demand collation, including how much volume they want for the innovator for a drug and how much volume they want for a generic for the drug, with the minimum purchase commitment. These were the few agreements which were signed before floating the request for proposal. The request for proposals were created by the technical team and the governing units. As we were doing this, pool procurement was being done in the country for the first time, and therefore it was important to guide the vendors regarding the process, and therefore a pre-bid meeting was held to address all the queries and regarding the process as well as the tender document. Once the bids were submitted, there was 3-stage evaluation which was done: pre-qualification, technical, and financial. And these different evaluations were based on parameters which were surrogates for the company as well as surrogates for the drug quality for which the tender has been floated. After ensuring that drugs meet a certain quality, then they qualified the technical evaluation bid based on the scores which were given for each of these parameters, and those selected companies were called for financial negotiation. During the selection process, we ensured that there should be at least one innovator if it was available, and 2 generics. This was largely done to, one, increase the competition between the vendors, and second, to ensure that there are no stockouts. And then subsequently, a 2-year award contract was signed between the centers and the vendor, and the monitoring of the purchase and distribution was done subsequently. If you look at the outcome, in the first cycle, we had 40 molecules with 85 stock keeping units. A total of 23 centers expressed the interest, and the pooled demand, if you look at the MRP's maximum retail price, was 197 million US dollars. If you look at the number of vendors who bid at pre-qualification stage, there were 33, and then after the technical evaluation, there were 24 vendors who qualified and signed the rate contract. However, 3 could not, honor their rate contract because of COVID. They had their, raw material prices had increased, and therefore, the pool procurement, 21 vendors were, involved, and the rate contracts were signed. What is important to highlight here is that if you look at the savings, there was almost 166 million US dollars which was saved. If you look at the MRP, and if you look at the reserve price, which was the lowest price for the previous year, it was 4.2 million US dollars. If you look at savings, it's roughly anywhere between 23 to 99%, with the mean of 85%. More savings were there if we look at the generics as compared to innovator drugs, but there was no difference based on the type of the molecule per se. Encouraged by this, we started our second cycle with more number of molecules, that is 77, higher number of stock keeping units, and this time there were more centers who participated, including certain state governments who participated in this. The pool demand was even higher as compared to the last time, and the savings were also higher. More number of vendors, because they understood the process over a period of time, bid this time, and the final contract has been signed after financial negotiation with 33 vendors. What are the implications we have for this pool procurement? One, the typical procurement happens based on the cost. However, in this pool procurement, the quality was considered first, and only those molecules as well as companies which qualified the quality criteria were then evaluated for their prices. So quality first, followed by the cost. We pooled the demand from so many centers, and as we saw in the previous presentation also, this is where we leverage the volumes to improve our negotiation ability. What it ensured, the differential pricing, which typically happens in our country between large center and small center because of the volumes, the differences in purchasing power, was taken care of by this pool procurement. The burden on the central body, administrative burden, was much less because we didn't, sign rate contract as a center, but instead of that, individual participating signed the rate contract. What it allowed them to bring in the center-specific requirements. So whatever their local hospital requirements or terms and conditions,
Hi, Dr. Manju. I think there is a problem with internet connection from Dr. Manju's side. And while we are waiting for Dr. Manju's coming back, so I think from the presentation that Dr. Manju presented, she has provided a comprehensive overview of how pool procurement can transform oncology care, and her presentation highlighted the process, outcomes, and also challenges and implication of the pool procurement, particularly for the anti-cancer medicine in India.
Sorry, I lost the connection. I'm back. Yeah. So these are some of the challenges which we faced with respect to the request from the centers to pick and choose the medication. There was lack of communication after they submitted the initial demands. In addition, the vendors who participated in the rate contract and the other vendors who were not selected, they attempted to lower their rates of the same drugs, and then they started contacting the centers to procure from them, vitiating the tender process. People were comparing the cost of their previous procurement. However, what they were not realizing was the quality of the drugs which were procured in the previous cycle. For the government center, it was more of bureaucratic hurdles because they were not clear how this entire process will fit with the government processes, even though everything which was followed here was as per the government norms. What we realize in both these cycles is that we do need to make effort to ensure that there is, the on-patent drug where we do not have generics. That is where we need to work on to get the optimal pricing for these on-patent drugs. If we look at what is the value with respect to what we have done at the level of country to other countries, National Cancer Grid is now expanding its in other low middle income countries through the NCG Global. And the idea is that the learnings what we have made in several areas, including the pool procurement, can be shared with others. And we do have an ASEAN collaboration with the National Cancer Grid. The delegation from the ASEAN attended the last annual NCG meeting where several of these things were discussed. So we are happy to take this forward and see how this can be applied in other countries, including the ASEAN. With that, I would like to thank everyone and apologies for everything which should not happen to happen here.
Thank you, Dr. Manju. There is a question for you at the Q&A box. So, India has done really good job in biosimilar and generic medicines, which from what I understand leads to better negotiation. Do you have any suggestion to other countries where the biosimilar or generic medicines will be available long after the original medicines were introduced, which make the access to medicine become a bit difficult?
Here can be replicated in many of these countries. And if there are no differences in terms of the procurement process and the approvals, then even the requirement between the countries can be pooled together. And we can think of, looking at as a central administrative section who can then negotiate on behalf of every country. I think what is important is, as we heard in the previous presentation, is some kind of a fixed demand or a forecasting which is available that this is the requirement which is going to be there over, next 1 year or 2 years from this different group, and which probably will help in reducing the cost for the innovators as well. In addition, I think we do need to look at other initiatives which are being run, like medicine patent pool, etc., to look at whether we can look at some kind of a differential pricing and bring in these on-patent drug to the countries where currently they are beyond the reach.
Thank you. And may I ask one more question on who are the key stakeholders that who should involve and when they should involve?
I think it's important to understand the processes within the country. So the government, the organizations which are involved in procurement as of now for the anti-cancer medicines, their involvement is the key so that we know that we are following the processes. In addition, it will be good to have experts who have done this earlier at a national level, involving them so that the process can be laid out very clearly. And of course, what I feel the users, meaning the clinicians, because we do need to see what is the demand and what's the usage, what is the acceptability which is going to be there. So I think it has to be a multi-stakeholder, process, as well as if there is a strong health technology assessment, base which is available in the country. Bringing those drugs which truly bring in value in this pool procurement process is going to be really helpful.
Thank you very much, Dr. Manju. Unfortunately, the time's up already now. So we need to move to our final presenter. And let me introduce our next speaker, which is Associate Professor Dr. Satariya Trakulsrichai, Head of the Ramathibodi Poison Center at Mahidol University. Dr. Satariya is an expert in clinical pharmacology and toxicology. She will share insights on the iCAPS initiative for antidotes in Southeast Asia. Dr. Satariya, we look forward to your presentation. Over to you.
Thank you. Thank you for your kind introductions. Can I share my slide?
Yes.
So, excuse me. Can you see my slide clearly? Okay. Good afternoon, everyone. First, I would like to thank the organizing committee for inviting me to be a speaker in this conference. It's my honor to be here. And today I will talk about using pool procurement for antidotes across the countries, the case of iCAPS in Southeast Asia. Okay. I do not have the conflict of interest. And first, I would like to introduce all of you to Thai National Antidote Program, which is the nationwide access to the antidotes. This program has been established and in operation since 2010 with the funding by NHSO Thailand. The objectives of this program include to solve the drug shortage problems and to develop an appropriate system for the antidotes. This program is established by the collaborations of several Thai organizations, including our Poison Center, Ramathibodi Poison Center. The system of the program is centralized, but has the mechanism for periphery to access the antidote and antivenoms efficiently. The capacity building includes 24-hour real-time service, Poison Center clinical consultation service, the guidelines, the trainings, and the outcome monitorings. The antidote and the antivenoms are stocked and distributed based on the poisoning data and their urgency or priority, such as cyanide antidote are stocked in the provincial hospitals in every provinces in Thailand and also the community hospital that is far from the central. So from Thai National Antidote Programs, the next step is the initiative for coordinated antidote procurement in the Southeast Asia regions or iCAPS. iCAP is the project which collaborate between World Health Organizations, CRO, and Thai organizations, including Ramathibodi Poison Center, NHSO, GPO, Thai Red Cross, and Thai FDA. iCAPS seeks to improve the access to essential antidotes and help prevent premature deaths due to poisoning. iCAPS does this by supporting public health system to secure the supply of essential antidotes through multi-country collaborations. So the benefits of this program are to access to antidotes and stronger supply chains. Participating country can request the resources of iCAPS to support capacity building to improve awareness about poisoning and prevention and train healthcare professionals in the management of poisoning and appropriate use of the antidotes. There are two pathways for coordinated procurement of the antidote. The first one is the planned joint annual procurement, and the second one is the emergency response pathway. The iCAP is included in WHO websites, as you can see, and also in our Poison Center website. So the first planned joint annual procurement, this pathway aims to ensure that the national focal point or poison center, who are authorized country representatives, can initiate their step for well plan and no other of essential antidote that are procured by the NHSO Thailand based on an annual agreement. So you can see the plan joint annual procurement in our website. This is for well plan and no other based on the annual contract. So the country that would like to order the essential antidote from this project or program can forecast the annual quantity of 8 selected essential antidotes or of these. So they have to plan and notify an HSO and the payment within 2 months before antidote receiving. They have to follow the steps of this pathway. The second one is the emergency response pathway. This is for emergency patients who need antidote very rapidly to save their lives. So it aims to ensure that the focal points or authorized country representative can initiate contact with our staff and follow the steps to ensure a fast, flexible, and rapid delivery of antidote to the patient. So this is emergency pathway that is fast, flexible, and rapid delivery to the patient to save the patient's life. This is the flow or the step. The step 1 to activate this pathway and the step 2, the response pathway after activation. This is for the step 1, the flow and the step to activate this pathway. Step 2, after activation, so that there are the steps or the flows to follow. The payment will be within 2 months after shipping. So that means the patients will receive the antidote before the payment. After the payment is different from the plan joint procurement. So this is the steps and they have to follow this. So now in this program, we have 8 selected essential antidotes, including like activated charcoal, chelations, and cyanide antidotes, and methylene blue treatment as methylene blue, methylglobin treatment as methylene blue, like this. And we also provide how to use the antidote, right? How to use contraindications, administration, dose, and adverse effects. And in our website, we also provide the treatment protocol, like for cyanide poisoning, because cyanide antidotes are included in our program. So like cyanide poisoning, lead poisoning, and methemoglobinemia. So that's all for my presentations. Thank you very much.
Thank you very much, Dr. Satariya, for sharing valuable expertise on procurement for antidotes. The presentation showcased the Thai National Antidote Program and how iCAPS facilitates planned joint annual procurement and emergency response pathway for essential antidotes. And I see that I wonder, like, for current, like, does iCAPS has planned to extend the procurement to other neighbors country, like to procure the antidotes together? And so far, like, would like to know about the status of the plan and also the barriers or the obstacles to extend to other countries. Thank you.
Oh, okay, thank you very much. So we plan to expand or extend the iCAPS to other countries, especially ASEAN, because some countries in the ASEAN are not in WHO 0. So we plan to expand to other countries in ASEAN And the obstacle of this program is for Prem joint procurement, because some countries have the problems about the budget to buy the drugs. And so even the drugs might not be expensive, but they have to create the budget for this. So now most of the pathway that we activated before are the emergency pathway.
Okay.
Thank
you very much. And there is one question about the application of pool procurement on medical devices. So I wonder if any of our speakers would like to address to this question.
So like the applications, or how you can contact to the iCAPS program. You can go to, if you are interested to join the program, you can go to the website, WHO website, or it's maybe easier if you can go to our Poison Center website. There will be all detail. I show you that the step and the form to be filled, and how to activate, and the number of the phone call or the email to contact if someone would like to procure the antidote in our program.
Thank you. And other speakers like Dr. Manju, Dr. Kim, would you like to address on the plan to extend to apply to the medical devices?
So I think from the whole concept of pool procurement can be applied to any products. It's specifically with products that have the biggest access challenges, where countries on their own are struggling to get the access at the price that they want or in the way that they want. So I think it can be applied to devices. It can be applied to diagnostics as well. I don't think there's a limitation. I think the key principle is that there needs to be a challenge that the countries are trying to address, and coming together as a group in some sort of a coordinated way is where the benefit lies, and then improving the availability of that product.
Thank you.
Yeah.
We are short on time again. So we will now move to the reflection and discussion section. Our first discussant is Mr. Blasco, UNICEF Regional Supply Advisor for East Asia Pacific. He supports UNICEF country offices with procurement and logistics, coordinating government engagements to ensure access to essential supplier for children to the UNICEF procurement services mechanisms. Next, we also have Mr. Murat, Ozturk, Senior Advisor for the Revolving Fund for Access to Medicines at PAHO. Finally, Dr. Kiesha, Prem, Assistant Professor at the NUS, Swee, Hock School of Public Health and the London School of Hygiene and Tropical Medicines. She leads public health efforts in Laos PDR and provides technical expertise to national HIV and TB programs in Cambodia. So, let's start with you. Could you share your thoughts on the lessons and challenges on implementing pool procurement?
Thank you. Thank you very much. Good afternoon. I hope you can hear me well. I think first of all, thanks for having me and inviting UNICEF to this very interesting webinar, and hope that we can share some of our experience. As per the introduction, my name is Blasco. I'm the Regional Supply Advisor for a UNICEF regional office for East Asia Pacific based in Bangkok. Indeed, one of the areas, one of the functions in my portfolio is to support governments, or support our country offices rather, as they engage with governments. And there's something that we call the UNICEF Procurement Services Mechanism. And that's simply a facility that UNICEF has made available over quite a long time to governments and partners to procure on behalf of them. So in other words, when governments ask for support for UNICEF to act on their behalf and procure typically health commodities, and more specifically, the example I wanted to mention today refers to vaccine procurement. If I look at data from 2023, last year, UNICEF procured vaccines on behalf of more than 100 countries globally, reaching about 2.7 billion doses. That's enough doses to vaccinate about 45% of the under 5 children population globally. So it's a very large scale. And I think it's from this experience at global level that I wanted to draw a few reflections as we start this discussion. Maybe the first reflection is about benefits. And I don't want to go again through all the benefits of pool procurement, because I think some of the presenters have articulated them clearly. But I do want to emphasize maybe a couple of points that are particularly important from our experience. And I want to emphasize our experience with vaccines. I think the element or the kind of the power that pool procurement generates to be able to convey clear, transparent information to the market in terms of demand predictability is really, really important. In the case of vaccines, and that's the example I want to focus on, vaccines have a particularly long manufacturing lead time. Sometimes the manufacturers available at a certain standard are not many. So ensuring a good flow of information on demand very well in advance, so that manufacturing plans, production plans can be well in place, is really important. And at the end of the day, it's really a fundamental pillar of us supporting uninterrupted supply at country level. So this is really our priority, to ensure that there's vaccine security and that immunization programs have access to vaccines at all times. So the ability of convey in a structured way and in a credible manner to the market demand information is really one very important benefit. The other one I wanted to highlight has to do also with the doors that pool procurement can open for influencing markets. And I think we know that well from the vaccine experience, where there have been over the years concerns about supply availability, and using the pool procurement approach and the knowledge and the predictability of that demand, but also the volumes behind the global pool procurement that UNICEF does, allows us as an organization to try to address market shortcomings. Could be in the form of influencing vaccine presentations, pricing. It could be in the form of incentivizing new enterers to produce certain vaccines, or in any other way. But at the end of the day, really focusing on promoting and facilitating sustainable supply of the right products that are relevant and as they're needed in the programs. So that's one reflection on the benefits. The other one reflection I wanted to flag, maybe it's on the key components of the pool procurement mechanism. And this is also both from our experience as a global mechanism, but also because we've engaged over the years with regional entities that were considering to design or deploy some form of a regional pool procurement mechanism. And in that interaction, we've also learned that there's some basic elements that are critical for the success of a pool procurement mechanism. I think I would summarize them as 6. The first one I would highlight is clarity on the scope. And it goes back to being very clear as this group of countries gets together on what is the objective that is trying to be fulfilled. Is it a matter of pricing only? Is it a matter of access to supply? Is it a matter of what is really the objective? And therefore, what is the scope of products that need to be included, so that there's focus and there's clarity in the design. Maybe the second element that is really critical is the governance structure. So what is the overall framework under which the pool procurement mechanism will function, right? So having a clear board that steers direction, having a secretariat, having an execution arm that manages, and then what is the internal controls and all the the regulatory elements that have to be in place to manage the mechanism. So having governance in place before operationalization is important. Thirdly, I think the financing model is something that needs to be clear from the onset. So how is the cash, how is the funding going to flow from the member states or the participant entities to the entity managing the procurement? Is it payment in advance? Is it a pre-financing mechanism and then reconcile later? There are multiple options, and I think some of the mechanisms we've had today may have used different approaches, and some of the colleagues on the panel have experience on them. But at the end of the day, it's clarity, because financing also comes with an assessment of what can work from the national fiscal landscape. We need to make sure that the financing flows are compatible with the budget cycles, the approvals at the Ministry of Finance level, etc., etc. Right. The fourth element that I think is a prerequisite is a clear country interface setup. So what is a unit that will be facing the countries or the member states that are ordering, and what are the communication channels to make sure that the ordering process is efficient, streamlined, and there are no duplications, right? I think a fifth key element that many of the webinar presenters today have highlighted is the element of quality assurance and regulatory considerations, right? So what is the potential, what's the level of harmonization that exists as the regional entity engages, and what are the opportunities to advance that harmonization? In the case of UNICEF, we've over the years relied very heavily on a global scheme, which is the WHO pre-qualification scheme for vaccines, that has made this type of consideration relatively straightforward, in the sense that countries that work with UNICEF or rely on UNICEF for procurement normally accept WHO pre-qualification of a certain vaccine as equivalent to pretty much registration. But that may not be the case, and I think as a mechanism is being put in place, reviewing regulatory considerations, both from a quality assurance, but I would also say from a legal and procurement law standpoint. So what are the boundaries of what the current law allows, and what is the design of the process that can make it compatible for that pool procurement mechanism to work for those countries? Finally, one sixth element is clarity on what are the core tasks that the pool procurement mechanism will manage versus maybe non-core tasks that can be outsourced to a third party. And here we move in that spectrum of different modalities that we've been hearing today, where you can have more information sharing type of pool procurement, or all the way to end-to-end procurement mechanisms that manage the entire process, from demand pooling, information, contracting, and even shipping and delivery, right? So very important to have all of these elements in place. And I would say very important to have a sequence as a design of mechanism is being considered, so that you start, or the regional entity starts, with clarity on strategic alignment, what's the scope, what are the objectives, move to assessment of capacities, assessment of regulatory reality and landscape, assessment of financing models, and then only then proceed with operationalization with a clear governance structure, with a country interface, and with all the control mechanisms. These are my quick reflections. Let me hand over to you, Inthira.
Thank you very much. Very interesting and very informative and rich. I know that we would love to hear more from Yon, but however, I think now we will move on to Murat. We love to hear from your perspective as well, on how PAHO's experiences can inform similar initiative in ASEAN. Thank you.
Thank you very much, colleagues. And Yon summarized perfectly everything, honestly, and nothing much for me to talk, to be honest, after Yon. But with some effort, I can try to connect the dots, because what Yon mentioned about the important criteria for success of a pool procurement, we can see them exactly at the talk of Dr. Manju Sengar about the Indian system, how they successfully implemented. And then in her last slide, she covered also some pitfalls. For instance, some suppliers directly trying to reach out the specific centers, try to sell the products outside the system. So in that regard, in one element, I can say at PAHO, the regional solidarity. Our member states established that system by their mandate in 1979, starting for vaccines. And in many instances, suppliers, especially with the COVID-19 pandemic, now try to reach out to governments separately and try to break down the unity. But the solidarity of the member states and sticking together for the benefit of a pooled system rather than individual benefits is very important. And to sustain that, the political commitment and overall regional solidarity will be key. And the success of our Revolving Fund maybe comes as the regional entity because we started early. Meaning that when the immunization programs, they were just initiating, and when the things are setting up, the procurement area for our member states started as an organic part of it. Currently, many other governments around the world, immunization programs, health systems, they have different separate procurement channels. It is quite difficult to harmonize and coordinate them now into one pool, and then also to ensure an efficient central secretariat. I would call this central procurement unit, central processing unit with effective cost. For instance, for PAHO, we are trying to sustain our system without additional subsidies with a very modest handling fees. And when we try to duplicate this model in other regions, I was working in Middle East with WHO EMRO, trying to establish a pool procurement system for 5 years in the past. We failed. And then I'm an ex-UNICEF officer also, and then I see how UNICEF things working more effectively at UNICEF in other regions. I could compare the big difference, and now I am with PAHO. So this cost-effective and then very professional central procurement unit will be key. And what I am seeing in many theoretical models, it is just being assumed as such units exist, and then the pricing assumptions and everything revolve around that. But it is quite difficult. What I can say, operating a pool mechanism is like learning swimming. We can talk about the theory of swimming, but we need to jump into the ocean and swim, and then it's a quite different skill set. And I need to give a disclaimer. As an ex-UNICEF officer working in the Pacific Island countries and knowing a little bit the ASEAN countries, that might be my 6th or 7th year of also attending a call with ASEAN countries on pool procurement mechanisms. So definitely the will is there, but the operationalization is delayed for several reasons, I guess. My recommendation would be really to explore UNICEF's pool mechanism in that region. And what UNICEF can achieve for you, what items can be procured through UNICEF effectively, and then what the global procurement power of UNICEF will be leveraged. And then if UNICEF cannot respond to any commodities, then for these commodities, something regional can be established. But my humble recommendation would not be try to create parallel channels or try to create small uncoordinated efforts which might not be sustainable in the long run. And when I was deployed to UNICEF, I learned a lot from Yon, and then you have an excellent officer there to coordinate such efforts too. Thank you very much.
Dr. Kiesha, as an infectious disease modeler, what are the critical factors for assessing the success of pool procurement initiatives? And also, we really keen to learn from your experience on pool procurement as well.
Yes, thank you so much for introducing me. So, good day, everyone. I would first like to thank the organizers for inviting me to share on a very interesting topic. My name is Kiesha Prem, and instead of speaking from an infectious disease point of view, I'm actually willing to share more from a strategic purchasing point of view. So I lead the Southeast Asian Regional Collaboration for Health, or SEARCH for short, which is a regional learning network housed at NUS and is supported by the Gates Foundation. And it brings together stakeholders from all of the 10 ASEAN member states, as well as China, India, and Timor-Leste, to strengthen strategic purchasing for health, which is with a particular focus on primary health care. So our work is centered around synthesizing knowledge on health purchasing mechanisms across the region and building capacity through mutual learning, as well as policy engagement and training. So if that's the case, then perhaps maybe a lot of my reflections actually are aligned with what Yon and Murat shared earlier. But from the perhaps maybe I can add in from the lens of strategic purchasing perspective. So pool procurement is indeed a very powerful tool for ensuring that health resources are used efficiently and equitably to address the population needs. So at SEARCH, our work focuses on strengthening the strategic purchasing within Southeast Asia, particularly for primary healthcare. And the key questions that we often ask are, how can we maximize the value for health spending to ensure better access and quality, as well as health outcomes? Pool procurement aligns quite closely with this goal. By consolidating the purchasing power, countries can achieve significant cost savings and improve supply chain predictability, as what all the other speakers shared previously, as well as ensure consistent quality of essential health commodities. So, as we've seen across the various initiatives, such as our colleague previously shared on the PAHO Revolving Fund and the regional examples that we had heard earlier on cancer medications and antibiotics, as well as antidotes, success depends on actually really overcoming the regulatory misalignments, logistical challenges, and the need to balance the local industries when there is with the global market access. So for the ASEAN region, procurement presents a unique opportunity, and countries in the regions already collaborate on other sectors. So applying this model to health technologies can unlock significant economies of scale to reduce inequities, as well as strengthen health system resilience. So I think from that point of view, SEARCH stands quite firmly to support that as much as possible. However, one point that I wanted to raise is that ASEAN member states also have significant diversity in their ability to pay for healthcare. The region includes several high-income countries, several upper-middle-income countries, and several low-income countries. And this economic diversity means that there is actually huge disparity in the health spending, purchasing power, as well as access to essential medicines. So more affluent and established economies can negotiate better prices and afford advanced technologies, while some low and middle-income economies often face higher costs, weaker supply chains, and limited fiscal space. I think pool procurement provides a strategic solution to address this imbalance. So by consolidating demand, ASEAN can leverage on their collective bargaining power to achieve lower prices, improve supply chain efficiencies, as well as ensure there is equitable access to the essential health technologies that we need across the region, regardless of the country's ability to pay. But I think what's interesting is the financing mechanism, as was shared by the previous speaker earlier. From a strategic purchasing lens as well, the aim of it is to ensure that health resources are allocated effectively, as well as efficiently and equitably, and in a way that maximizes health outcomes of the population in need. So with this lens, I reflect on the earlier three presentations. So the three initiatives: Secure, the National Center Grade NCG, and the iCAPS, which demonstrate how strategic purchasing can actually improve access, efficiency, and equity in the health system by addressing some of the critical challenges in this case, drug procurement. So Secure tackles essential antibiotics to combat drug-resistant infections. And from a strategic purchasing perspective, it optimizes on the what to purchase by prioritizing high-impact antibiotics that strengthens supply chain through market intervention, ensures that there's stewardship for appropriate use of medicines, and it highlights the importance of transparency and accountability to deliver value while safeguarding public health. The presentation on the National Cancer Grid in India exemplifies procurement for high-cost cancer medication. And we have seen how that can easily cripple a country altogether. So by consolidating demand and prioritizing quality before cost, And using multi-stage evaluation, NCG achieves lower prices and equitable access for especially the smaller NCG centers. And this focuses on governance, and rate contracts allows it to address the supply chain vulnerabilities, and this aligns quite well with the how to purchase effectively. And there are key lessons here for robust coordination, capacity building, and trust to overcome some of these challenges, like the bureaucratic hurdles and demand delays that were shared by the speaker. iCAPS is a regional antidote procurement initiative which combines planned and annual procurement with emergency response pathway, and it ensures timely access to life-saving antidotes. And this is dual approach highlights the flexibility in procurement models. So it strengthens supply chain, improves capacity through training and awareness, but it's a practical example, hopefully within the region, for how you can solve drug shortages and improve healthcare system resilience. So I think together this endeavor underscores the power of strategic purchasing to maximize the value of money and ensure that there's a stable supply, promote equitable access for health across all of the countries that are participating in the pooling process. In ASEAN, I think the lessons are clear. Food procurement underpinned by governance, demand forecasting, and regional collaboration is a transformative strategy to strengthen health system and achieve better health outcomes. So yeah, over to you.
Thank you very much. Thank you, all discussants, for those insightful remarks. May I remind our audience, so please feel free to put your questions in the Q&A box, and then we will open the floor to audience that we will share your questions. And like all the discussants and as well as our speaker already said that the pool procurement they provide a benefit for affordable access to essential medicine or essential health technologies. And we have already learned from other regions as well, like they have already set up the guidelines and like other steps to start to do the procurement at the regional level. However, like as Dr. Kiesha just said that it's possible or there's opportunity, evidence already confirmed that. But I wonder like what are the main barriers like to implement pool procurement in ASEAN region, and how can these challenges be overcome? Yeah, speakers or discussants, please feel free to respond. Jan, over to you, please.
Yeah, maybe I can speak a little bit based on ongoing conversations, and I think there are opportunities already. And continuing the topic I was presenting about on vaccines, we've been discussing with the ASEAN Vaccine Security and Self-Reliance Initiative, which is an initiative led by the National Vaccine Institute of Thailand. They're the focal points for the AVSSR. And one of the pillars or one of the key elements of their action plan is indeed to explore a pool procurement mechanism. So there is potential, there is intention, and there's willingness. And I think Murat has alluded to this before. I think the hurdles remain those that we've all been talking about, which have a lot to do with regulatory, with bureaucratic processes, but ultimately they have to do with regional collaboration and alignment around the objective. So I think one of the key points we're discussing with AVSSR at the moment is how maybe UNICEF can support the process of the early stages of facilitating or sharing experience on that strategic alignment, and maybe linking this to the point that Murat was raising about, when it makes sense to create a regional structure and whatnot. I think one of the opportunities in ASEAN specifically is to maybe focus the role and the tasks of such a collaborative arrangement on addressing those hurdles, those bottlenecks. So focus the effort of the initiative on gaining political will to address regulatory issues, to harmonize wherever possible, to address any impediments that have to do with policy, fiscal cycles, procurement laws, and create the right conducive environment, and then maybe work with potentially other entities, partner organizations, so that they don't have to create the entire procurement entity from scratch. So there are hybrid models, and I think that's one of the options that AVSSR under ASEAN is considering for vaccines. Certainly for other commodities, I'm sure there's interest, but let me stop there, focusing my input on vaccines. Thank you.
Thank you. Murat, please.
Just to complement John, so when you initiate a full procurement system, the overall reliability of the system is very important. And when you are trying to coordinate multiple entities in the system to start with, there will be different procurement timelines, there will be different regulations, there will be different stock situations, there will be different product choices. That will create a big, deviations on the objectives. Meaning that you might try to make an agreement with a supplier for, let's say, hexavalent vaccine for 2 million doses, and then one of your participants say that, sorry, I cannot implement, I need to delay, then I cannot do the regulatory harmonization, etc. It will impact all your credibility, and you will have a big bumps in the start. To avoid that, for instance, to be part of a global contract and to give flexibility to ASEAN countries, if it is about vaccines, it will be always better to go with a bigger entity like UNICEF or like Gavi. Any UNICEF holding Gavi contracts too. And then, for example, a middle-sized country or a big country in Asia try to make up their minds, have a start, they will be delayed, maybe some small countries ahead of them. Then the overall, when you bundle in a global arena, the fluctuations of countries in Asia will not impact the overall system. On the other hand, if you want to start something from zero, depending on other countries, the whole harmonization, what we call this as PAHO, you are as fast as, or you are as reliable as the weakest link. And it is a great challenge when the PAHO started also. Maybe for the first 5-10 years, we had lots of bumps. I mean, we are talking now after 45 years of success with confidence, but because we had achieved this harmonization. To go through these bumps will be the hardest part after the operationalization of the pool system. Thank you very much.
Thank you very much. Okay, I'm looking at a Q&A box. If you have questions from the audience. There's one question on what has been the main barrier for implementing pool procurement in Asia? Phil Spectrum, we already mentioned that we have been trying or discussed for years. And I also wonder what are the potential priority areas for implementing pool procurement? Whether we should, if for vaccine, we should join or collaborate with UNICEF, or if antibiotic, we should ask for capacity building or involve with secure, for example, or any other priority area that maybe it is low hanging fruit for ASEAN region. Thank you. Anyone would like to respond for that question? Kim.
Yes, maybe I can just mention, I think the biggest challenge is, as mentioned already by all the speakers, is around creating a mechanism that benefits all whilst allowing each country to have flexibility. And it's kind of an all or nothing sort of approach. And I think where we have been trying to understand how to create an antibiotic mechanism or work with countries and existing mechanisms that can include antibiotics in their process is trying to find that balance between country solidarity, their own procurement laws, and how can they still be part of some sort of benefit of a powerful coordinated mechanism, but still have the ability to use their own tendering processes, regulatory processes, and still be compliant with their own rules in their countries. And I'd be quite keen to hear from the other participants that have implemented mechanisms, can we be flexible, or do we have to be very strict and coordinated such that it's the benefit for all and everybody's rules and processes have to change?
Murat, please.
It's a great question.
So audience, please feel free to type your answer or questions in the Q&A box. Murat, please.
For instance, for vaccines, for some products, the profit margin is quite low. And in terms of the regulatory alignment, our countries, to get the best prices, they have to coordinate. If each country, if they say that I have the best regulatory system, each vaccine should register in my country, they need to go through XYZ, then it's not a full procurement. And when we look at the pricing of the coordinated mechanisms, like Gulf Cooperation Council or other entities, it is quite high. If we want to achieve effectiveness, because Canada, for the different states, they have full procurement. The United States, they have full procurement too. But are they optimal best prices? Maybe for these rich governments, they get whatever best for them, or for GCC. But compared to power prices, they are 10 times or 20 times more. Our power is coming from the operational efficiencies. Our country is complying with our system. When I was serving in Middle East, for example, in one of the countries, we wanted to introduce pneumococcal vaccine. And that country has a very particular rule saying that a company wants to introduce a vaccine, they need to have an office in the capital city. Knowing that, companies offer that low middle income country much higher prices than Gulf Cooperation Council, because they know that there is no competition because of a very specific regulatory rule. So this alignment, working together, is so important. And companies, you will be, if there is a profit to be, to be exploited, they will do that. For instance, we are closely following the antibiotics market too, and Kim might know. And some companies, when they're negotiations, they are excluding Latin America, meaning that they are not giving the rights to sell these products at affordable prices at Latin America. This is quite disturbing for us. And many Asian countries sometimes can be excluded too. Even at the global level, we are having challenges with big multinationals and then other patent holders. How can we overcome that is a different question too. It is not only the regional entities bringing power together, but we need global coordination overall between the entities as well. Thank you.
Thank you. Yeah, there's many things to be done. And so next, I would like to call Les. He asked question previously, and I think it would be good if he can ask by himself. So because I don't think that I can ask on behalf of him. Okay, Les, over to you.
Oh yeah, thank you, Inthira. I hope you can hear me.
Yes.
This is Revolving from the UNDP Regional Health Team based out of the Bangkok Regional Hub. Good to be here with you. Thank you so much, Tata, for organizing this incredibly interesting discussion. And I think a topic that I don't think is explored deeply enough or widely enough, given all the benefits that can be generated through pool procurement approaches. And the discussion so far has been hello.
No. Oh, your sound is not clear.
No, sorry, can you hear me now?
Yes. Mm-hmm. Yeah.
Yeah. All right, I'll try to speak louder. Just wanted a couple of comments, and in fact, the question I had at the start, Kim, thank you so much for your response. It is about addressing some of the challenges that have already been raised multiple times over the last hour and a half, in terms of ensuring how it is you promote the alignment between countries. How do you ensure that there is an enabling environment and ecosystem within these countries so that you can have pooling of procurement, right? Now, and I guess, coming out of this discussion, a lot of these lessons will need to be documented. I think what would be valuable is for countries to learn about what it is that they need to do in preparation for implementing a procurement approach like this. What sort of agreements and capacities they need to have in place prior to moving forward on a mechanism like this, and the top role that a regional institution like ASEAN can play in facilitating such a mechanism. But what I also observed through the conversation today is that a lot of these discussions are around specific groups of medicines or vaccines or products. So I'm wondering what we can extrapolate from this discussion and apply to a broader set of essential medicines. Because if you're talking about, for example, using a procurement mechanism to address shortages of antibiotics, for instance, we have countries like Bhutan or Timor-Leste or Maldives who actually have experience chronic shortages of a large group of essential medicines, right? How do we address those concerns, and how do we use procurement to address them, right? And then, looking at the specific examples like Secure, can we actually, take an existing mechanism that obviously is working well and expand it to other medicines? And I think that question was already raised earlier. And then finally, my point around, when you talk about the ASEAN countries, and as was rightly pointed out, there is a range of economies in this region. So when we talk about procurement, should we be thinking more carefully about who is part of the procurement? Can we pre-select countries with the same economies, with legal systems and regulatory systems that are already aligned somewhat and harmonized, so that we make the practice of pooling of procurement a little bit less burdensome and easier to implement. And finally, just one final point. There was a suggestion around utilizing an existing mechanism like UNICEF, a platform that UNICEF had already established in terms of pooling of procurement. Now, I think, yes, absolutely right. And they are doing a great job as they are. Then why not? Let's look at how it is that we can maximize the support that UNICEF can provide around that. But, that brings the question of sustainability and ownership and self-determination, obviously, right? So, any support, I'm not wanting to be too provocative here. Colleagues, but I guess what my point is that any support we provide countries in relation to procurement, there really needs to be a component where we are also at the same time building institutional and technical capacities, as well as supporting them in the procurement aspect of the in procurement, right? Anyway, I'll leave it at that for the moment. I'm sorry if my sound is a little bit unclear. I hope that my points came across okay. Thank you.
Thank you. Thank you, Les. So our panelists who would like to respond first, Kim, please.
Let me maybe start by responding on the addressing shortages. So we spent a lot of time talking to various experts around how do we fix a shortage issue, especially if a shortage is due to manufacturers exiting a market or kind of a supply chain on the manufacturer side creating the shortage. So as we saw with amoxicillin last year in the Northern Hemisphere, there was a massive shortage combined with a demand increase because of a much more difficult winter time with children, but also there was a manufacturing bottleneck and supply chain problem. And one of the things we realized is that pool procurement, to have enough in your stockpile of that product, which is massive volumes, it's expensive to keep in a warehouse, might not be the most feasible way to address the shortage. So we spent some time working with UNDP, with WHO, regulatory supply chain, to look at how could we understand what countries are currently doing to address the shortage issue. And we spoke to some upper middle income and lower middle income countries around what are their regulatory and policy interventions. And actually, if a country has an established contracting, tendering process with multiple suppliers that are quality assured, that has the mechanism of long-term agreements and has a longer kind of period of contracting of 2 to 3 years, also having mechanisms of buffer stock available for both on the manufacturer's requirements side as well as the country, those countries don't necessarily get impacted by the shortages. They also need to have their own ability to visualize their stock and demand. Now, that's not possible in all countries. So a global mechanism might not solve the shortages for antibiotics, but strengthening countries' own abilities to do registration and their own abilities to get the procurement processes in is maybe the better answer. And there's been a lot of work done by multiple organizations here to try and support that part. That in itself has created this procurement solidarity strengthening of countries now saying, we have these really good procurement mechanisms and these rules for tendering, and therefore it makes it a bit difficult for us to align into some sort of a pooling mechanism because we don't always have the same rules that apply, and we can't circumvent our rules because we're wanting to be part of a global mechanisms. And I think that's where some of the tension lies in trying to set some of these mechanisms up.
Thank you, Kim. So next, Dr. Kiesha, please.
Thanks. Just very brief comment. I think maybe for ASEAN, perhaps, as we know about the economic disparity within the country, a model like uniform pricing will probably not work. And I'm wondering if perhaps we could consider the potential of using tiered pricing, which takes into account some aspects of GDP that will at least allow for perhaps the more affluent economies to contribute more to a system. But I'm not sure what perhaps the other panelists have to say about that. But over to the others. Yeah.
Thank you. Yon, please.
Well, yeah, I was going to comment on another point, but maybe picking on that particular comment from Kiesha. I think, yes, the pricing or the approach to pricing and negotiations is important. And in a region like, or in this region in particular, well, I do believe that maybe tiered pricing could be a solution. I mean, in general, UNICEF has traditionally favored and focused on tiered pricing, partly because, well, for many reasons. One, probably internal policy related or kind of principle driven. But in general, because of the wide range of the wide spectrum of countries that UNICEF supports, there was a big risk that focusing on a single pricing approach could end up undermining certain countries and elevating prices that maybe lower income countries could otherwise benefit from. I think in this region, I would think that tier pricing could be an option to consider. The other point that I wanted to make maybe is twofold. One, I think we need to remember, maybe I'm stating the obvious, that regional pool procurement is not going to solve all the problems. Okay, so when we look at access issues, we have to understand the root cause of an access problem. If the stockouts are caused by poor national forecasting and lack of sufficient domestic resources in the national budget, pool procurement is not necessarily going to solve anything, right? So we need to understand at country level and regional level, what are those root causes and to what extent pooling will actually solve them. And this is why I keep going back to alignment on strategic objectives, and therefore selecting those commodities. The other point I had was on the point made by the colleague from UNDP. Certainly, there are global existing mechanisms. UNICEF is one, Faure Revolving one is another one that's regional. I think none of those mechanisms want to in any way displace the national capacity, whether it's for procurement, for planning. What they are is always available so that countries themselves can decide where to invest, where to focus their capacity. And I think one of the advantages of these mechanisms is that they're not necessarily incompatible with strengthening national capacities, whether it's on planning, on policy elements, on forecasting, and even on procurement processes. So I think there is value in having both approaches and finding a balance between what tasks a certain country may decide to, let's say, outsource to an existing mechanism versus which ones need to be retained as core within the national system or in a regional entity. Thank you.
Thank you very much. And may I ask Dr. Manju about your thought on like the discussion on extending to do the pool procurement among ASEAN countries, like for you have already done or started the cancer oncology medicines, and the cancer is also now becoming the cause of death of many ASEAN countries. So what I would like to know about your thought better, like the extension to other countries. Thank you.
Thanks, Inthira, for that question. Definitely, what is, I think, required before we begin and we expand this to other countries is to understand the systems with respect to what works. What are the typical procurement processes? What are the expected hurdles if we start the same process, what we have done as part of National Cancer Grid? What are we going to, what are we expecting if we have to just replicate the entire process in the ASEAN countries? So we need to look at what are the current challenges if we were to replicate the same process? Who are the people who need to be involved in these countries? What are the regulations around, suppose even if we have a pharmaceutical company who has a generic, what are the processes for marketing, if they are approved as of now in India, whether there is a way to get the approvals for same generics in these countries? And in absence of approval, what are the ways for, exporting these drugs or sending these drugs across? So I think there is a whole lot of, exercise to understand the current regulatory infrastructure around, how the drug approvals work, how the procurement happens currently, and then, bringing everybody on the table. And I think this is where probably even the pharmaceutical companies which are making generics, bring them into the talks to see how best we can facilitate this and see, how we can, involve the ASEAN countries as a group rather than individual countries, and see, the same process, whether we can, do it there. Dr. Pramesh is here with me. So, I just wanted to request if he has any additional comments. This is purely my, understanding and thought process, if he has anything different.
No, I think Dr. Manju covered it quite well. And first, while it would be very important to understand the procurement processes, the approval processes of each of these countries, I suspect that we would potentially almost certainly have to go into some kind of a tiered costing system, because obviously it would be extremely difficult for us to expect that pharmaceutical companies would supply the drugs that they do in India at the same cost that they would do in other parts of the world as well. And to involve the ministries of health at a very high level within these countries would be extremely critical. And that's one of the reasons we did invite them for the NCG annual meeting. And there seemed to be some interest from the ministries as well, because getting the ministries involved at that level certainly irons out some of the hurdles that we would otherwise face if we were to deal or to work with the procurement organizations within those countries. But it certainly got a lot of potential, and I suspect the benefit would be extremely high for smaller countries like Timor-Leste, Bhutan, Myanmar, which otherwise would lack the bandwidth to be able to do this on their own. So I certainly hope that it works.
Mm-hmm. Yep. Thank you. Dr. Murat, I think I saw your hands previously.
Oh, no worries. Thank you very much. I wanted to raise a point regarding PAHO's unique experience for the tier pricing approach, because we have different set of countries, and some of our countries like United States and Canada, they are really developed, and then we can say really high income countries. And these countries do not procure through us anyways. But we have some other pseudo high income countries like Trinidad and Tobago or Bahamas, several Caribbean countries. These countries considered high income by a, how to say, problem in the global GDP estimations and taking averages. And these countries are being punished by that approach. And unfortunately, there is no global mechanism to try to find solution to that. When I was serving in the Pacific, for example, Vanuatu is quite poor country, never GAV eligible. The reason for that, Australian gamblers becoming citizen of Vanuatu and increasing the GDP of the country. But nothing coming to Vanuatu to profit help the people. And country cannot access to several vaccines. We need to mobilize resources through Asian Development Bank. So tier pricing is a two-edged sword. I would really advise extra caution. At the initiation of the Power Revolving Fund, several companies also try to approach our countries differently just to break us apart with tier pricing too. For that reason, as PAHO, we have a mandate not to accommodate tier pricing. We have only exception to Gavi in that regard. Thank you very much.
Thank you very much. And looking at time, I think I wish we had more time to delve deeper, as all the speakers and discussion have been truly excellent and insightful. Before we end this section, I would like to ask each of speaker and discussion for the brief key message. So let's start with our first speaker then. Dr. Kim, please.
Thank you so much. And just want to say, I do think when we start to consider mechanisms for pooling, we do need to consider the dynamics of the product and what are the access challenges. And we should be not applying a one-size-fits-all solution to all things, specifically what we've been seeing with the antibiotics and the challenges around access. Thank you so much.
Thank you. Dr. Murat, please. Oh, sorry. Dr. Manju, please.
So the same, on the same lines, we do need to understand what are the local requirements rather than, just imposing something which has worked in one place, and the local regulations, understanding the, the needs of the local, of a particular country, and then moving ahead with pool procurement is something which is going to be helpful.
Thank you. Dr. Satariya, please.
Thank you. So for me, antidotes are the essential drugs that can save the patients with the poisoning. So the shortages of antidote is quite important in our perspective. So share procurements or share the stockpile might overcome this problem. Thank you.
Thank you. Yon, please.
Yeah, thank you. So for me, it's again similar message. Make sure that any pool procurement mechanism starts by focusing on clear objective. What exactly is the problem that we are trying to solve through the mechanism, and that the entire design, including the selection of products, the modalities, the partners, the stakeholders, the pace, is aligned to serve that specific objective. Thank you.
Thank you. Murat, please.
I want to reiterate Dr. Kim's point on there is there is no size fits all approach. And then starting with something particular like HPV vaccine, for example, through UNICEF, and then for antibiotics through Secure Initiative, and building upon that slowly and customizing for each product will be good consideration for the future. Thank you.
Thank you. Dr. Kiesha, over to you, please.
Thank you. So I think, well, procurement holds great promise in improving access and efficiency. I feel that, as what the other speakers have already shared, we do need to understand what the what the regional requirements are, what problems are we really intending to solve. So yes, over to you.
Thank you. So we have reached to the end of our time for the Q&A session. Thank you all for your thoughtful and engaging questions. Today's webinar has provided a wealth of knowledge on the potential of pool procurement to improve access to essential health technologies. Key themes include importance of stakeholders, collaboration, strategic planning, and capacity building. And to close, I would like to invite Dr. Apa Mendiratta from the Center for Global Development for the final remarks.
Thank you very much, Dr. Inthira. So good afternoon, good evening, everyone. On behalf of the organizers, it's my great honor and privilege to deliver this vote of thanks for this insightful webinar, where we learned how we can optimize costs, strengthen supply chains, and ensure equitable access to essential health technologies while leveraging pooled procurement mechanisms. I have my heartfelt gratitude to our distinguished speakers, Dr. Kim Faure, Dr. Manju Sengar, and Associate Professor Satariya Trakulsrichai. I also want to thank our discussants, Mr. Blasco, Mr. Murat Ozturk, and Dr. Kiesha Prem, who added depth to the conversation. A very special thanks to our moderator, Dr. Inthira Suya from the Access and Delivery Partnership UNDP for steering today's discussion with such clarity and focus. We're deeply grateful to the HITAP Foundation and the team, particularly Manit Sitimarth, Zin Newbin, and Sudamni Tabak for organizing this webinar in collaboration with the Access and Delivery Partnership hosted by the UNDP program, PMUB Thailand, and the Center for Global Development. And last but not the least, a very big gratitude to all the participants for joining in, engaging actively, and contributing to the success of this discussion. Your presence is deeply valued, and we look forward to receiving feedback from you on this webinar on how we can continue this conversation. In closing, we look forward to continued collaboration and further dialogue in advancing pool procurement strategies to improve health outcomes across this region. Today's session underscores the immense potential within the ASEAN region to adopt pool procurement strategies. So thank you once again, and have a wonderful day ahead.
Thank you. Thank you, everyone.
Thank you.
Bye.
Thank you.
Bye.